All right, so today I'm going to be demonstrating the placement of a intraosseous needle or introducer into a pediatric patient in the tibial bone. So the first thing I'm going to do is, if my license requires it, I'm going to go check and see if I have a physician order. If there is a physician order, great. I'm now going to come back and identify that I have the correct patient by checking the name band and that matches the order and it matches the person who I think I'm going to do this procedure on. I'm then going to wash my hands. And I am going to gather my supplies. So I'm going to need a ChloraPrep, a 15 millimeter interosseous introducer needle for a pediatric patient. Today I'm going to be demonstrating using the adult 25 introducer and the adult bone just for demonstration purposes. I'm going to need a flushed IV pigtail here, a dressing, and I'm going to need the introducer drill. And it's good to this point just to check to make sure the drill is working. Great. Okay, so I am going to talk with the parents and make sure that I've discussed the risks and the benefits. So the benefits are going to be, I'm going to be able to give IV fluids and medications through this line once it's placed. The risks might be damage to the bone, bleeding, infection, but they're very rare. So now I've done the risks and benefits. I have my equipment here. I'm going to position the patient. So the patient needs to have their legs extended. And what I'm going to want to find is the tibial tuberosity by palpation here. So I'm going to palpate down to the tibial tuberosity. Where I'm going to place this needle on a pediatric patient is 1 centimeter medial and 1 centimeter inferior to that tibial tuberosity. In a pediatric patient, you may have to use the patella to identify, because it may be difficult to find the tibial tuberosity, so you may have to go a centimeter inferior and then a centimeter medial to the patella. So, but here it's going to be right, so it's going to be here, here. So I'm going to be placing it right about there, okay? So now I have my location. At this point, I'm going to put on some gloves. And I'm going to cleanse the site with ChloraPrep. So this is going to be 30 seconds of cleansing. Okay, so the area is now cleansed. I am now going to set up my drill. I'm going to, again here, I'm using the 25 millimeter introducer needle for demonstration purposes. I'm going to attach it. I hear it click, so I know it's engaged. I'm now going to hold the leg in position, go to my previously decided area. I'm going to apply at 90-degree angle. I'm going to push through the skin. I've now hit the bone. I see that there is one mark out, so I'm able to then advance, turn on the drill and advance it into the bone. Now I've advanced it into the bone. I'm going to remove my drill, remove the introducer needle. That's going to go into the sharps. Okay. At this point, I'm going to attach my IV, which is flushed already. And with a pediatric patient, I'm only going to do 2 to 5 millimeters of fluid, rapid flush, to make sure it's patent and that there's no swelling or infiltration around that site, which I don't see. So now I've successfully placed this intraosseous needle. I'm now going to place on the dressing. This goes over here, and I pull these 2 tabs to secure the dressing, and I'm going to reattach my IV. This can now be hooked up to a IV line with a pressure bag or a pump. At this place, I've placed the interosseous needle. I'm going to then go record the procedure in either the medical administration list or our medical record. I'm going to remove my gloves, wash my hands, dispose of sharps. And that's how you place an interosseous line on a pediatric patient in the tibial location.
Thanks for watching this video. Do you want to learn more or become certified in this skill? Just visit us at simrated.com. Be sure to check out our other videos.